In the ICF, major cations are potassium ion and magnesium ion, while the major anions are phosphate ion. Protein, is protein an ion? Anion, cation? Huh? Okay. In the ECF, major cation is sodium ion, and the major anion are chloride ions and bicarbonate ions. Okay, these ions can also move from compartment to compartment to maintain homeostasis. I said that before. Alright? So they can be exchangeable between the ICM and the ECM. You will get to know more of that as we proceed. So what are the functions of electrolytes of body fluids? Functions of electrolytes of the body fluid. Number A, they help to maintain acid-base balance. Number B, they help to maintain proper osmolarity and volume of body fluid. Alright? I think these are the two major functions of electrolytes found in the body fluids. But they have other functions. Look, the main electrolytes. Can you see that on the slide? The main electrolytes of body fluid are one, sodium ion, chloride ion, magnesium ion, calcium ion, and potassium ion. These electrolytes have some important and specific functions in the human body. So if I ask you, what are the functions? What are the functions of sodium ion? Yes? Functions of sodium ions in the body. Do you have sodium ions in your body fluid? What are their functions? It's not enough to just begin to list. We are talking physiology. The functions of sodium ion, yes. Who knows? It doesn't have any function. Okay, hand is up.
Ayo.
Regulation of osmoregulation balance. That grammar is big for your body to understand. Look at how they are looking at you, very confused. Osmoregulation balance. Huh? What is osmoregulation balance? Yeah, you left cellular level, you are going to molecular physiology. Osmoregulation balance. It's right, but let's start from the known to the the known to the unknown, yes? Functions of sodium ion. Functions of sodium. You want to write the quiz? Jesus Christ. Right.
Now speaking to the mic.
To regulation of pH.
Can you hear her? Those of you behind, can you hear her?
Regulation of blood pH.
Regulation of blood pH.
Okay.
That's good. Acid
Base
balance. Acid base balance. Okay. Any other attempts?
Yes.
Contraction of muscle. Contraction of muscle. You have been given excitable tissues. Also, good.
I think the basics
At this
point.
you are expected to know the basics. Sodium ion, one important function it has, forget speaking big grammar, is to help in the contraction of muscles. Do you have any other function? Yes? Good. Fantastic. Propagation of action potential. That is still contraction of muscle. Action potential. It also helps in generating action potentials in nerve cells. Have you not done action potentials in neurons? Have you done that? The lecturer didn't teach you that. So what causes depolarization? Yes? What causes depolarization? Sodium ion. It's not just enough to, okay, depolarization is the alteration of the resting membrane potential. What causes it? It is the influx of sodium ions into the muscles or nerve cells that alters normal resting membrane potential. So whenever there are shifts of sodium ions from the extracellular fluid to the intracellular fluid, or from the exterior to the interior, whether in nerve cell or muscle cell, depolarization occurs.
So good.
All right. What is the function of calcium ion? What is the function of calcium ions?
It helps in the contraction of smooth muscles.
Yeah?
Smooth muscles, the contraction of smooth muscles.
Smooth muscle contraction. Okay, that's a good one.
Like
Example.
Of smooth muscles, okay, the muscles found in the trachea, the walls of the gastrointestinal tract, the muscles found in the of the esophagus, yes. I think that's all.
give me one
Give me one function of calcium ion in heart muscles.
Heart muscles?
Yes.
Heart
Yeah.
muscles, cardiac muscles.
Did I say heart?
Yes.
Did I just say heart?
Yes, sir.
No. Cardiac muscles, please. Yes.
No, clotting of blood. Clotting of blood.
He says it helps in clotting of blood, calcium ion. That's correct. But I didn't see functions of calcium ion in body fluids or blood. I said, what is the action of calcium ion in the cardiac muscles?
The calcium ion help
Alright, that's beautiful. The major function of calcium ion in the heart is to cause prolonged action potential of the heart. That is plateau or plateau. Alright. The reason we have, remember that sodium ion can also cause contraction or depolarization of muscles. But in the heart, what initiated depolarization in the heart is the influx of sodium ions. But when depolarization reaches its peak, the sodium ion channel closes and then the calcium ion channels opens, causing influx of calcium ions into the heart muscles. And because of that, there is prolonged depolarization of the heart, which is known as plateau. Okay? Good. Those calcium ions have any other function? Someone just said it helps in clotting of blood. That is correct. Yes? Any other function? A.
ions help
Helps in the release of neurotransmitters from the vesicles. What vesicles? Huh? What vesicles? Synaptic vesicles? Huh? I mean all synapse? Huh? Okay. It is the same calcium ion that causes synaptic vesicles. Alright, busting of the synaptic vesicles leading to the release of acetylcholine. Okay? Good. Well, how about potassium ions? Yes, it doesn't have any function. Functions of potassium ions. Okay. Your hand is up.
They also help improve the influx of improve the influx.
They also help in muscle contraction through what? Efflux. Ah, does it really help in muscle contraction? Huh? Or muscle relaxation? Relaxation. Okay? The influx of sodium ions and calcium ion causes depolarization and contraction of muscles and nerve cells. But whatever there is airflows. What's the meaning of airflows? Huh? That the sodium ion is entering or leaving the cell. Huh? Leaving the cell. Okay. Whenever there is airflows of potassium ions, then there will be repolarization and restoration of the resting membrane potential. So, it will be in your own interest to go and look at the functions of electrolytes in body fluids. Okay? All electrolytes in the body have their functions. So let's go forward. So the next thing I want us to look at will be the measurements of body fluids. Measurements of body fluids. Body fluids can be measured in the laboratory by using some biological markers. Alright? Simply put, biomarkers. There are several biomarkers that can be used to measure body fluids in the lab. You can become professional doctors in the future. So a patient can come to you having either problem with water balance, okay? And then you really want to ascertain what the problem is, because you have to give your prognosis and diagnosis.
So what?
So when you do, you simply pick your laboratory sheets, send the patients to the lab, and remember it is those in MLS that will be carrying out all of the measurements or tests of body fluid compartment. So the thing is that everybody in college work together. Okay?
So
But it's good you have adequate knowledge of how these body fluid compartments can be measured. We're running out of time, so we're going to run through measurements of body fluid. We'll begin with measurement of total body water. Measurement of total body water. Total body water can be measured using the following biomarkers or biological markers. Total body water can be measured using the following biological marker.
number one
Number one
is
deuterium
oxide. Alright?
deuterium oxide. The formula is
D
like our battery is there. The formula is D2O. Alright? It is also known as heavy water. H2O is what? H2O. Water. Deuterium oxide. The formula is D2O.
so it
It is one of the important biomarkers used to measure total body water. Okay? Others are the tritium oxide and aminopyranes. But the major biomarker used to measure total body water is deuterium oxide. Okay. the ECM compartment, is measured using biomarkers such as inulin, mannitol, sucrose. Alright? Those are the major biomarkers used to measure the extracellular fluid compartments. Inulin, mannitol, and sucrose. Okay. Others like the radioactive substances, bromide sulfates, thiosulfates can also be used to measure ACM volume compartment. Alright? Plasma volume or compartment. Another word for the plasma compartment is known as what? Intravascular fluid. So the intravascular fluid compartment can be measured using biomarkers such as radioactive iodine, is on the slide. Radioactive iodine, Evans blue dye, radioactive isotopes of chromium. Alright? So these biomarkers can be used to measure the intravascular fluid compartment of body fluid. Going forward, the intracellular fluid compartment does not have a known biomarker which one can use to measure it. But we can determine the intravascular fluid compartment by using this simple formula. Alright? So ICF can be measured by calculating the difference of total body water and the extracellular fluid compartment. Okay. So if, for example, the total body water of, what's your name? Chindo. Is it Chindo? Chindo. If, for example, the total body water of Chindo is 40 liters, okay? And her extracellular fluid volume is 13 liters. What is her intracellular fluid volume? 27 1 degree. Okay. So her intracellular fluid volume will be 27 liters. Is that normal or abnormal? Is she normal or abnormal? Check. Are you sure?
Yes.
What is the normal volume of the ICL? 28 liter. I ask you again. Is Chingu normal or abnormal? Very abnormal, right? Huh? Okay.
Okay, she's normal.
She's normal, alright? Good. So by applying this formula, if the total body water is known and the extracellular fluid volume is known, you can get the intracellular fluid volume of your patients. Going forward. Also, interstitial fluid volume falls under what category? Huh? Extravascular. Okay. To measure that compartment, you apply this formula on the slide. Because there are no known biological markers to measure that compartment or fluid compartment. So by applying or checking the difference of the extracellular fluid volume and plasma volume, you can get the extravascular fluid volume. Alright? Good. We are going to solve mathematics in this class. Did you say you have another lecture? Okay, let's just put it random. Alright. Before we go, we shall look at the features of a good biological marker. Features or characteristics of a good biomarker. Alright? On the slide, you have all of the characteristics of a good biomarker if you must use them. Because actually you are going to be injecting this biomarker into the fluid compartment of your patients or your subjects. So you need to do a proper screening or check that this biomarker will not harm or kill your patients. We don't want to graduate doctors who will be very careless, and instead of giving substances that will heal their patients, they go and give substances that will kill their patients. Many of you here will graduate as Boko Haram doctors. There are many doctors out there who, instead of saving lives, destroy lives. Many of them. So, I pray you don't fall into that category.
Amen.
Some of the characteristics of a good biomarker are as follows. Number A, it must be non-toxic. It must be non-toxic. Don't go and give somebody's child poison. in the name of trying to measure fluid compartment. So you have to ensure that the marker you are injecting into your patient or subject must be non-toxic. Number B, it must mix evenly in the fluid compartment. Number C, it should be easily measured. Number D, it should have no effect. It should have no effect on the distribution of water. You know what that means? Water is not static. I said that before. There are substances you can inject into a patient, and it's going to stop water from flowing normally. So it has to make sure that the marker you are injecting into somebody's child should not affect the distribution of the water content of the person. And then number A, B, C, D, E, it must be unchanged. And if changed, must be known. Okay? So please, these are some of the characteristics or features of a good biomarker. Alright? Other health professionals will be under you. So it is your responsibility to ensure that nothing goes wrong under your watch. Because some of you will be running your private clinics. Some of you would, of course, become consultants in the future. Some of you would work for government or in public hospitals. And if you're a doctor, that position comes with leadership role. So you should know that you'll be leading other health professionals. I didn't say you should go and be telling them, I am the boss, the head of, and be giving commands. That is not what I'm saying. But you should ensure that nothing goes wrong. So that when you are sending a patient to a lab, ensure that the persons there are performing the correct tests. Because sometimes, most laboratories you see around are being operated by quacks. So you should know the kind of laboratory you send your patients to, so that they don't come back giving you incorrect or accurate results, and then you begin to prescribe medications based on that result, and instead of what you have prescribed to bring healing, you kill your patients. Please. Anyways, you will do medical ethics and jurisprudence, as you proceed. So going forward, there is a formula used in calculating or measuring or determining body fluid compartments. So sometimes we use formulas to determine body fluid compartment. I hope you can still see the slide. Let me tell you. Our PowerPoint works whether there's light or no light. So put on your glasses and look at what I'm showing you on the slide. So if you see or check the slide, you will see a formula. Use a measuring body fluid
Compartment.
Okay. So the formula is mathematically, right? Mathematically. Fluid compartments can be measured using the formula V is equal to M over C. V is equal to M over C. Alright. Where V means volume of fluid in the compartment. M is the mass or total quantity of marker or biomarker injected. I said M is the mass or total quantity of the marker injected. Some authorities will call that the volume of biomarker metabolites. Alright? And then C is the concentration of the biomarker. Okay? Now simply put, on the modified formula is giving us volume of the substance is equal. Are we writing? Volume of the substance is equal to the amount of the biomarker injected. Volume of the substance is equal to the amount of the biomarker injected minus the amount of biomarker metabolized divided by the concentration of the biomarker. I said the modified formula is giving us volume of substance is equal to the amount of biomarker injected minus the amount of biomarker metabolites divided by the concentration of the biomarker. Okay. We are going to solve some problems. But that will be in the next lecture. And then we'll do some mathematics, and then we'll look at the significance of body fluid and some pathologies or pathological conditions that can either decrease or increase the volume of body water contents. Okay. So, questions?
Yes, sir. Sir, sorry. You said something concerning the radioactivity of certain biomarkers, and then you said in the requirements that they should be non-toxic. But then how does that correlate? Because I feel like radioactivity. I thought radioactivity is not good for the body.
We didn't say it's radioactivity. We are not saying it's radioactivity. We say radioisotopes. It's different from all these radioactive substances. Okay? So please, take note of that.
you said that biomarkers should not change, and if change should be noted. But there's also a characteristic that says that biomatter should mix thoroughly with the fluid compartment. When it mixes, it means a certain type of change.
That is why in the formula I gave you, there is volume of biomarker injected, volume metabolized. Alright? So you know the volume of the biomarker you're injecting into the patient. Of course, when you inject it, it's going to metabolize. Alright? So you note the volume that has been metabolized, and you subtract it from the original volume given to the patient. And that is why in those features I gave you, I think there should be, the biomarker should not change, but if changes occur, it should be known. Did I say that?
Yes.
Good. So by the time you put this together, you will know the volume you have given to your subjects and the one that has been metabolized. And then you take the difference. And then of course, you should also know the concentration of the biomarker. Okay? Any other question? Yes? How do you know the volume that has been metabolized? Okay. That is why we have machines in the lab that can detect all of this. Okay? How does people know the volume or the amount of a drug, a hard drug you took when you go to the lab to run a test? You know that anything you drink, whether orally or a way of injecting the drugs into your system or body fluids, it can be detected through your blood and your urine. Sometimes you send patients to the lab, go and do urinalysis. Go to the lab, let them to run so test. If I want to know the amount of glucose in your blood, it's simple. You want to know whether someone is diabetic or not. There is a normal range for glucose in circulation. So I'll just simply take your blood, take it to the lab, and then we run the test, and then we'll see if it's 180 moles per liter or deciliter, and is that normal? Is the person hypoglycemic or hyperglycemic? So it's the same way. Because you are injecting this substance, you can know the changes by way of taking the blood or taking urine and running a test. Is that clear? Any other question? Okay. When are we meeting again?